Thank you. So to me, it's a really important message and address as president of your academy to all of you members, and to tell you where we are and how we're addressing challenges that's coming ahead in the future. So, sorry about that. All right. Good morning and welcome to NAM's 54th annual meeting. As we gather today, we find ourselves at a pivotal moment for our nation. As you know, the presidential election is only 2 weeks away. And I know many of you, like me, are feeling the weight of what's to come. The nation's decision this November will have impact on collective future, including on health and healthcare, spanning basic research, public health, pandemic preparedness, access to care, women's health, and more. As member Larry Gostin aptly noted in his JAMA paper, health is on the ballot, and the implications are significant, with outcomes that could vary drastically depending on the election results. But no matter who occupies the White House or Congress, the NAM, all of us, remain steadfast as a champion for science-based medicine and for health policy, as we have for the last 50 years. From Nixon to Biden, through Republican and Democratic administrations, we have played a pivotal role in driving some of the most impactful advances in health science and medicine. At National Academy of Medicine, we recognize that political divides shouldn't matter when health of Americans is at stake. You know, I can think of no better example than our work throughout the COVID-19 pandemic, an unprecedented emergency that brought grief and loss to so many of us. But throughout the pandemic, we collaborated with two administrations, bridging divides to focus on what matters most, safeguarding the health and well-being of American people, and especially the most marginalized communities. We will always uphold our independence, objectivity, and unwavering commitment to advance science and evidence. But we welcome perspectives of diverse stakeholders across global, national, state, local, and political levels, and from public and private sectors, so as that can inform our work. But make no mistake, to stay true to our mission, we do not hesitate to challenge policies that disregard or deny science, create or exacerbate inequities, or those which are detrimental to healthcare. For example, in 2019, alongside with my fellow Academy presidents, the NAM issued a statement reaffirming the science of climate change when it was challenged by the highest level of government. When U.S. withdrew support from the WHO, during the pandemic no less, we issued statements strongly condemning that decision. And in 2022, when the Supreme Court overturned Roe v. Wade, jeopardizing the reproductive health and well-being of millions of American women, including those vulnerable populations, we did not hesitate to speak out. So you can count on this. The NAM will always defend science and work on to assure health equity for all. Now, these examples are nothing new, because since our inception, we've always followed the science to shape critical research and policy advice, regardless who's in the office. In the 1980s, our landmark report on HIV and AIDS galvanized the nation to confront this deadly epidemic at a time, actually, when many in Washington sought to downplay it. But the good news is, decades later, we work closely with the Bush administration and with Congress to provide critical guidance on the President's Emergency Plan for AIDS Relief, or PEPFAR. Thanks to bipartisan leadership, PEPFAR is now estimated to have saved 25 million lives across Africa and across the world. Support for this program has remained strong across 10 U.S. Congresses and 4 presidential administrations. But today, the future of this program is less certain, with Congress extending its authorization only through next year. So to me, the message is very clear. We must continue our support, but at the same time reassessing our progress, especially with the U.S. Sustainable Development Goal of ending HIV epidemic by 2030 in sight. Without question, NAM's contribution, your leadership run deep. Over the years, we have provided crucial guidance to Democratic and Republican lawmakers on a range of issues, from combating tobacco use to improving food and nutrition standards, to closing health equity gap, to addressing health implications of climate change. I've been privileged to serve as your president, and during my tenure, the NAM has worked with 5 Congresses and 3 presidential administrations. Across all, you, our dedicated members, have shared your expertise in really impactful ways. We have built strong bonds and trust with many committed public servant leaders, including, for example, Peggy Hamburg and Tom Frieden in the Obama administration, Kevin Drugemeyer and Scott Gottlieb in Trump administration, now Monica Bertinelli and Rob Califf in the current administration, and of course, our own Tony Fauci and Francis Collins across all these administrations, among many others that we work with. So I would say that despite being appointed by presidents with very different political views, these leaders are our friends and are united in their commitment to the health and well-being of all Americans, not just those who vote for a certain political party. And we'll continue to work closely with all administration to serve the nation. Under Obama administration, for example, NAM was instrumental in providing recommendations on how to define essential health benefits following the passage of the Affordable Care Act. Many of you recall our crucial report recommending preventive women's services, health services, all of which I'm pleased to say will remain covered today. And in 2017, in the face of intense debate in Congress on the future of ACA, Mike McGuinness and I visited Congress, and with administration leadership such as HHS Secretary Tom Price and others, and we were joined by our members, former Senator Bill Frist, a Republican, and separately by Tom Daschle, Democrat, to share the NAM Academy's report recommendation for affordable care and the importance of ensuring health coverage for the nation. We all know that ultimately bipartisan prevailed, and today more than 45 million Americans have insurance because of the ACA. As I noted earlier, we're also uniquely positioned to rise above political divisions, do critical work on behalf of all Americans. For example, despite at times confusing and misleading messaging from the White House during the pandemic, the NAM worked closely with the agencies to deliver science-based recommendations. As you can see, at the request of CDC, NIH, we developed a report on how to equitably allocate COVID-19 vaccines for Americans, which inform policy in states and localities. The Academy has also established the Standing Committee on Emergency Infectious Disease at the request of the White House and HHS to provide rapid expert consultation on everything from crisis standard of care to social distancing. And then, as you can see on the left hand of the slide, as opioid epidemic ravaged the nation, we launched our Opioid Action Collaborative with then the Assistant Secretary of HHS, Brett Giroir of the Trump administration, who served with us as co-chair. And then as FDA's request through Scott Gottlieb, we produced a report providing clinical practice guidelines for responsible opioid prescription, which certainly in the early days played a really important role in shaping prescription practices and federal policies. So we'll continue to focus on issues that matter to Americans, from making prescription drugs more affordable to strengthening the medical supply chain. So we are really grateful for valuable connections we forged with the current administration. So you're going to hear from Surgeon General Vivek Murthy. He, in fact, co-chairs our Action Collaborative on Clinician Well-being and Resilience. And you can see we have launched a national plan for workforce well-being and a campaign. Likewise, Assistant Secretary of Health Rachel Levine has been a vital partner on our Action Collaborative for decarbonizing the health sector and for our substance use disorder collaborative. More recently, we collaborated with White House and HHS Office of Climate Change and Health Equity on a series of convening related to the nation's pledge to reduce greenhouse gas emissions. And then our strong relationship with the Office of Science Technology Policy have enabled important work to address issues such as AI, emerging technologies, firearm violence, and climate change. So as I reflect on lessons learned over past administrations, I'm proud of this enduring truth that the NAM stayed true to our mission while remaining nimble and adaptive, even when facing seismic challenges and existential threat posed by pandemic, climate change, and the shifting political landscape. We have strengthened our resolve to implement advice and recommendation. So we certainly believe in moving forward more actions than just advice. We expanded and deepened collaborative partnerships. We learned to communicate our work even more broadly. We're combating misinformation and disinformation, and you are providing leadership at the intersection of science, medicine, ethics, and the law. Now, this latter issue is particularly timely now, as recent legislative and judicial decisions directly impact the practice of medicine, our social contract, in many areas such as reproductive health, gender-affirming treatment, and others. So as we look forward to a new administration and Congress, the NAM will draw on the strength and insights we developed over the years. You know, each transition brings its own uncertainties, but also opportunities to forge pathways and deepen our impact. The foundation we built positions us well to navigate these challenges. This is why our role advising the nation, the very reason for our existence, is so vital. Since 2016, ahead of each presidential election, the NAM published Vital Direction for Health and Healthcare. This initiative has provided expert, nonpartisan guidance on critical issues. So for 2025, we've brought together bipartisan members and experts. And as you can see in the slide, identify key priority areas that we want to advise the next administration. AI in healthcare, biomedical research, climate change and health systems transformation, public health, and women's health. These will be the 6 papers published in Vital Directions, which we will definitely share with the new administration and Congress. So for the remaining of my remarks, I'll be laying out these 5 high-priority actions for the next administration, as you can see in the slide. And I'm going to go through every one of them to say, what are we saying to the incoming administration? What do we need to do to assure health and well-being for our nation. First, we urge the incoming administration to prioritize improving public health and reducing health disparities. Well, you know this. U.S. health outcomes rank among the lowest of all developing countries, even though we spend far more than anybody else. At the same time, we invest significantly less in addressing inequities and factors that impact health status and the so-called social determinants of health. So to truly improve health outcomes for all Americans, the next administration must integrate public health, social care, care delivery, and address social determinants. We think that CMS should incentivize collaboration with community-based social services that find coverage for social interventions, so-called social prescriptions, and identify effective pilot models for integration. At the federal level, health agencies should partner with departments that have significant impact on social determinants, such as the Department of Housing, Transportation, and Agriculture. And to support this work, we need much better access to data linking public health, social care, and care delivery. Now, the government can play a role in defining technology standards for health and social data integration, with particular attention to data sharing, privacy, and security. But we can also learn from success at state level. In Indiana, for example, the governor formed a statewide task force that brought together academic, government officials, business, community leaders to move beyond partisan debates and secure buy-in for significant public health reforms. This is the kind of nonpartisan solution that we should all strive for. Second, it's really imperative that our next administration catalyze transformation towards a health system that's integrated, effective, efficient, equitable, affordable, and continuous learning. We all know that our fragmented healthcare system impedes coordination and hinders efforts to address the broader health challenges, putting already vulnerable population at greater risk. So therefore, we must integrate care delivery, break down silos between primary care, specialty care, public health, and social services. Health and Human Services can advance this goal by developing incentives and requirements for healthcare organizations to prioritize, accelerate integration across their care delivery system. And there's also a big need for payment reform. Many problems inherent in our current health system stem from the traditional fee-for-service models, often fail to align with health outcomes and contributing high costs to patients and systems. We think that CMS should accelerate the shift to innovative payment models that prioritize quality, efficiency, and patient outcomes. I already mentioned this. Another important idea is data integration, improving interoperability, a priority already with bipartisan support. So, for instance, interoperability could be tied to reimbursement, similar to the current standard require certified electronic health record for CMS reimbursement. And of course, finally, we must remember that prevention, early detection, treatment are critical for improving health outcomes and are cost-effective. So we call upon the next administration to guarantee clear standards and accountability for measurements for preventive services, ensuring providers are rewarded for delivering whole patient care. Third area, urgent address emerging critical challenges in health and medicine. As you know, we have done this a lot in the last few years, that we're no longer waiting for Congress or administration to ask us to tackle what emerges as critical issues, but NAM is taking them on. But we want to make sure that government also see this as ready to address critical emerging issues. A top priority is to improve preparedness for infectious disease outbreak. The pandemic showed how devastating infectious disease can be to our health and society, and how they amplify existing barriers, healthcare access, affordability, equity, and outcomes. So as we develop responses to H5N1 and Mpox outbreaks, the next administration must learn from both successes and failures of nations' approach to COVID-19 to avoid repeating mistakes when new threats emerge. Also, as a leading international academy, we, the NAM, must work with our global partners addressing emerging threats to global health security. Climate change also imposes an urgent existential threat to human health and well-being. The next administration should tackle climate change as a top priority. Healthcare community like us can play a critical role by communicating the negative health impacts and by decarbonizing our own health sector. We also need to establish standardized sustainable metrics and mandatory emissions reporting. So the next administration should continue substantial incentive provided by the Inflation Reduction Act for health systems to pursue decarbonization and to improve their resilience to climate-related events. And finally, we need a national comprehensive plan to address so many urgent issues that shorten lives of millions of Americans, particularly those who live in rural, underserved communities. Deaths of despair, fire and violence, maternal mortality. We believe that to be ready to deal with emerging challenges, we will call on the new administration within its first 100 days to convene diverse fields and experts to identify the most significant threats, health opportunities for policy intervention. A multidisciplinary convergent science approach is crucial, addressing the growing number of threats to population health. Fourth, AI. Next administration must advance the use of AI for health and healthcare while mitigating the risks to patients and societies. We all know this. Data science, AI, digital tools offer enormous potential for improving patient outcomes, enhancing operation efficiency, and facilitating new drug discovery and precision medicine. So the future administration should leverage AI to promote data-informed decision-making for population health, equity, and well-being. To build capacity, the federal government will need to support large-scale build-out of data and computation capabilities, as well as infrastructure to scale impact and benefit. Now, in recent years, the private sector has really dominated because AI requires a lot of massive infrastructure investment and human capital. So we call upon the new administration to invest greater support in AI research in public and academic sectors because of the need for resources, infrastructure, and training programs to develop a future-ready workforce. And certainly we need a lot more public-private collaborations. But while AI offers so much promise, we have to address the concerns. We have to ensure that AI implementation not only maximizes benefits, but mitigates risks such as biased algorithm, potential dual-use application, and capacity to contribute to mis- and disinformation and really malfeasance. So AI in healthcare must be developed and used responsibly, ethically, and equitably. Therefore, the administration must lead the implementation of a comprehensive governance for AI. Such efforts should span multiple federal agencies overseeing healthcare, research, information technology, and must cover the full technology life cycle. So what do we recommend? Implementation of a unified targeted AI governance framework, such as the AI Code of Conduct that is being developed here at NAM. We're now under development, which will provide guidelines for high-level principles and practice rules for the work of all health stakeholders. Next is, and the final, of course, is science and innovation. Strengthen science innovation to improve health outcomes, to provide evidence for policy, maintain global competitiveness, and drive economic growth. Now, if we look back since Vannevar Bush 75 years ago, when he put forward the idea of science and endless frontier, I would argue, and you would agree, that we have made impressive, groundbreaking medical advances, improvements in human health that stem from U.S. leadership in biomedical science. Such investment also fueled economic growth, job creation, and technology development. That's really exciting. But despite its successes, the U.S. research biomedical sector now faces significant challenges. While the U.S. leads the world in overall R&D spending, we risk losing our competitive edge. For the past 20 years, China has driven nearly 30% of growth in worldwide R&D, compared to 23% in the U.S. As you can see in this slide on the right corner, picture is the percent of, in fact, contribution growth of China versus U.S. Other countries are emulating our successful research model. They've increased a lot more in research facilities, attracting top talents, producing high-quality research, and challenging our position as a global leader in science. Additionally, we can claim success by saying, look at HIV and cancer. It used to be a death sentence. We now see people living much longer, and in fact, one's even talking about eliminating HIV. But as you can see in the middle slide, we still face high rates of chronic disease health disparities. As is shown in this slide, despite significant investment in biomedical research, our outcomes rank among the lowest of all developed countries. And then you can see on the left side, our workforce, we're falling short in growing our scientific workforce. First, Black and Hispanic scientists remain underrepresented across the entire STEM field. We have sizable pay gaps for our trainees, and it's particularly related also to gender, race, and ethnicity. And then if you look at this data, it shows that U.S. relies on international trainees to meet workforce needs. More than half of our biomedical scientists are non-U.S. citizens or naturalized citizens like me. And many international trainees wish to stay in the United States but face difficulties in obtaining continued temporary or permanent legal status. So the next administration must address these challenges through policies and actions. If we cannot support a diverse, talented, competitive workforce, we'll fail to build our decades-long models of scientific progress and innovation. So earlier this month, the NAM released a landmark special study report on the state of U.S. biomedical research enterprise, led by Al Reese, a scholar-in-resident, the former dean at the University of Maryland. And with this committee, our report recommends the administration the following. One is we need to be strategic versus being fragmented. So we say the administration should convene an independent body of experts from diverse fields, academia, government, industry, patient groups, and philanthropy, to really take a high look at the totality of our health needs and create a vision and strategy for research, biomedical research for a nation. This report also recommends the establishment of a national funding collaborative. So rather than funding by government, industry, private sector, philanthropy separately, we can create a funding collaborative. We can share investment to be more strategic. We also asked to improve the federal coordination of research across the agencies and further invest in convergent science and strengthen the competitiveness of the research workforce. These actions should ensure that the U.S. remain as global leader in biomedical innovation. As I've discussed, even with progress that we have achieved, not all patients benefit equally from advances in the biomedical research innovation. So I see many of you who are major translational basic scientists, and certainly we have traditionally the value of death, which has gaps and delays in funding and translating promising discovery, basic discovery, to clinical applications. But let's face it, we have gene therapy, we have genome editing, we have AI, synthetic biology, the GLP-1. We're all reaching, in fact, clinical installation, but not everybody has the ability to benefit from them. So in the recent JAMA article, my co-authors and I call attention to a second value of death, which we call the health equity value of death. You can see in this picture. This refers to a gap in access where disadvantaged populations are unable to benefit from biomedical advancement due to socioeconomic, environmental, political, and systemic factors, or health system failure, difficult in closing the last mile in care. This exacerbates health disparities and erodes trust in research enterprise. So the report's final recommendation is to take action to address health equity value of death to assure equitable outcomes for everyone from scientific innovation. So members of the NAM, taking policy action is never easy, particularly in today's partisan landscape. However, the NAM will continue working with the new administration and members of Congress to champion the goals in the coming years, irrespective of political differences. I remain optimistic about the future, just as I was in 2014 when I first took this job and privileged to serve you as your president. Having the benefit of 10 more years of learning and experience, I can tell you that we have faced difficult times, but we have persevered to drive meaningful change. So as the philosopher Goethe once said, and I quote up here, in the realm of ideas, everything depends on enthusiasm. In the real world, all rests on perseverance. We know that real change won't happen overnight, but regardless of setbacks, we must be bold and remain enthusiastic, and we must persevere every day to improve the health and well-being of all Americans, and for that matter, everyone globally. The state of NAM is strong and growing even stronger thanks to you, the enthusiasm, perseverance of all of you, our staff, and our volunteers. No matter who leads the next administration and Congress, we'll remain committed to our core mission and values. Since 1970, NAM has been driven to advance health and well-being for all. We're not motivated by politics, but our vision and commitment to a healthier future. And we'll continue to serve as a foundation for health and scientific progress in the United States and elsewhere, irrespective of who's in office. I know our member staff are united by shared purpose and a collective hope for the future. So as we move forward to 2025, we'll continue to build on these efforts. And I certainly look forward to working with all of you. So thank you very much for supporting the NAM and for your great guidance and leadership. Thank you.